Well, we will be keeping you up to date with that story. Moving forward, despite the gradual resumption of doctors to their workstations in public hospitals, health services are yet to normalize in most facilities, with clinical officers and medical laboratory officers still on strike. Patients seeking services at level 2 and level 1 facilities are still stranded. Unions of the two cadres of health workers are now warning of continued industrial action until the Ministry of Health and the Council of Governors pay attention to their grievances, as Elizabeth Kisiangani reports.
The ongoing strike by clinical officers and medical laboratory officers has had a significant impact on the provision of healthcare services in public hospitals. While doctors have started to resume their duties, the overall normalization of health services in most facilities is still pending. The strike has particularly affected patients at level 2 and level 1 facilities, leaving them stranded and without access to essential medical care. These facilities, which cater to a large number of patients, are now grappling with a shortage of healthcare professionals, leading to delays in diagnosis, treatment, and overall patient care. The unions representing the striking health workers have made it clear that the industrial action will continue until their concerns are addressed by the Ministry of Health and the Council of Governors.
Recently, there was a report that HIV tests results that we are getting in the country are not accurate. It's because Ministry of Health has decided to engage Class 8 dropouts to test HIV. These are the people who are manning VCT centers.
These concerns primarily revolve around issues such as inadequate staffing, poor working conditions, lack of career progression opportunities, and insufficient remunerations. The clinical officers and medical laboratory officers play a crucial role in the healthcare system, providing vital services such as diagnosing and treating patients, conducting laboratory tests, and assisting doctors in various medical procedures. Their absence has not only disrupted the workflow in hospitals, but also put additional strain on the remaining healthcare professionals who are already overwhelmed by 3 months on the pandemic. The impact of the strike is not limited to the immediate healthcare services, but also has long-term consequences. Delayed or inadequate medical care can lead to worsening health conditions, increased mortality rates, and a burden on the healthcare system as patients seek alternative options or require more extensive treatment later on.
Monday, we are going to withdraw all our services from the National Blood Transfusion, from the National Public Health Lab, the members that are working in Camry, the Research Institute, National Public Health Lab. We are going to withdraw our services. Because if we can have a strike for 1 month and the employer is not ready to sit on the table.
The Ministry of Health and the Council of Governors must urgently address the concerns raised by the striking health workers to resolve the ongoing crisis. It is crucial to engage in constructive dialogue, negotiate fair terms, and find sustainable solutions that not only address the immediate grievances, but also ensure the long-term well-being of healthcare professionals and the patients they serve. The normalization of health services in public hospitals is essential to ensure that all patients, regardless of their level of care, receive the medical attention they need. It is imperative that all stakeholders work together to find a resolution and prevent further disruption to the healthcare system, ultimately safeguarding the health and well-being of the population.
We are on strike to ensure that we can have equal treatment for workers. For the UHC staff who are being mistreated, and you know very well that the county continue to hold that they must continue within the next 2 years on punitive terms, which we are not supporting and we are against it.
However, the Kenya medical laboratory officers and clinical officers who have been on strike for more than 30 days now, accusing the government of failing to formulate a recognition agreement despite having met all the requirements. The lab officers are also demanding that all employees under the union to be placed on permanent and pensionable terms of service. In the strike notice, the lab technologist is also demanding for employment of 1,000 additional lab officers to bridge the shortage in their department. Reporting for Tanda News Outlook, I'm Elizabeth Kisiangani.